I'm very happy to welcome you this afternoon to this webinar addressed to people living with sickle cell disease and dedicated to COVID-19. As you may know, the ERN is facing different challenges of this COVID-19 pandemic. Like we are gathering information on the correct treatment and management of the infection of coronavirus in patients affected by rare hematological disease. We have a specific session dedicated to that on our website. We have also launched an European collaborative platform on red blood cell disorder and COVID-19 patients. And at the end of the October, we had an educational session and an educational program, and one of the session was dedicated specifically to COVID-19, and it was during this session, there were almost 40 participants, that we perceived the needs of having a webinar dedicated to this topic. First will be Mariane de Montalembert having a speech presenting you this topic. And she's the head of the hemoglobin disease unit at the Necker Hospital, which follows 600 pediatric children. She's also a member of the French Society of Pediatrics. She's a member of the ERN-EuroBloodNet. She's a member of the EHA, of the ASH. So she's very expert physician. And I'm also very pleased to introduce you Noémi Roy, who is expert in adult sickle cell disease. So we have a pediatric expert and an adult expert. She's a hematologist at the Oxford University in London. She's, of course, interested in hemoglobinopathies, rare inherited anemias, and she's very engaged in using patients' voice in research, in developing of best practices, and understanding the patient's pathway for high quality care. So I'm very honored to pass the floor to Mariane and Noémi. Thank you very much.
So as a pediatrician, I will begin. And I am a pediatrician in one hospital in Paris called Necker. If we consider, and I will talk you about studies performed in children with sickle cell disease. There is a French register. There are several registers in the world. There is one Italian one, there is a British one, there is a French one, and there is, for instance, also a register from the US. I will present you the French one because I know this register really well, and I will present you also the American one, which has been just presented last week at the American meeting called ISH. The French register, which is held by my colleague Jean-Benoît Harlet on behalf of our organization. This register, in France, we can consider that there are about 30,000 patients with sickle cell disease, and that most probably one half of are children. So if we're talking about children, we can consider that there are about 15,000 children affected with sickle cell disease in France. At the beginning of the pandemic, we asked to all physicians taking care of patients with sickle cell disease to fill a file if they had a proven case of COVID-19 infection. And at the very beginning, it was the first wave in March and April. And you can see that 83 files were completed. Out of these 83 files, they were 17 children. So on one hand, 15,000 children in France, and on the other hand, 17 children with sickle cell disease concerned by the COVID-19 infection. There are mostly SS genotype. the proportion of children receiving hydroxyurea is the same as in the usual sickle cell disease population in France. Half of them had not only COVID-19 infection, but also they had a vaso-occlusive crisis. 1/3 were transfused. They stayed for a median of 4 days, and few of them had complications. Jean-Benoît Harlet made this comparison. He compared the rate of hospitalization for patients with sickle cell disease and for patients in the general French population not having sickle cell disease. And when you look at the children, they are less hospitalized than the general population. But when you look at adults, they are, here you have a rate of hospitalization 17%, and the general population, it's almost twofold rate of hospitalization. But when you move to patients older than 45, they are more hospitalized than the general population. Here is, in my unit, we had the mission to take care of all the COVID-19 infections in Parisian area. And we have seen that they were in few cases, but some of them had a difficult form. And here are the 4 cases who needed intensive care unit. If we look at, they were from the age 11.5 to the age 17.5, all of them recovered. But some of them, all of these 4 cases of acute chest syndromes needed extended transfusion, and it was indeed quite a strong, quite severe acute chest syndrome, but all of them recovered. If we move to the register from the US, this register has been presented past week at the ASH meeting. And this register is called Secure Sickle Cell Disease Registry. I will focus only on children. 366 pediatric cases, most of them coming from the US. Median age, 10.9. Genotypes, again, mostly SS. Half of them were hospitalized, and 1 death was recorded. If we compare the hospitalization rate of patients with sickle cell disease and patients in the general Black population, which is the register called COVID-19 data, you can see that here children are more hospitalized if they have sickle cell disease than if they haven't. And the difference of hospitalization rate is higher in adults. If you move to the fatality rate, as I told you, 1 death was deplored in the US and no death in the French register. But there is an increased risk in adults. What was looked for were the risk factors for having a very symptomatic form of sickle cell of COVID-19 infection. What was found out in the US was that previous acute care for pain, sickle cell disease-related heart and lung comorbidities, and it was written and it was told neurobehavioral disorders, but when we listened to the talk, it was very severe. Neurobehavioral disorders were associated with COVID-19 hospitalization, and previous acute care for pain was associated with more severe cause of COVID-19 infection. When Mariangela gave me the list of questions, I saw this question: do some treatments such as cyclos protect against COVID-19? I should answer no. And I think that all the registers say that COVID-19, that hydroxyurea, cyclos, hydrea, as you can call it, does not protect or does not increase the risk of getting infected with COVID-19. But all specialists think that it can protect against the risk of developing acute chest syndrome. And now I will move to the very difficult question of school. If we go back to infections in children, we see that there are few cases of symptomatic infection in children. We see that globally children are less frequently infected, less severely infected, less contagious than adults. Even keeping in mind what is a very rare complication of many viral infections, including COVID-19 infections, which is called by some persons Kawasaki disease and by others the PIM, pediatric inflammatory multisystemic syndrome. These PIMs are not more frequent in patients with sickle cell disease than in patients not with sickle cell disease. Therefore, globally, what as a pediatrician I observed was a dramatic increase of psychological stress, of psychological distress in children during the quarantine. And now we are facing a dramatic increase of hospitalization for really dramatic, terrible psychological consequences of school exclusion. Therefore, all French pediatricians wrote that it was not reasonable to exclude children from school, but in almost all cases, with very few exceptions, such as having just been transplanted, while of course recommending to maintain healthy environment and watching and mask and social distancing. I've just quoted a paper which was recently published, and the title is Back to School and COVID-19. It is urgent to control our fears and to move forward the good of children. Thus, that's the end of my presentation. As a pediatrician, I will be very happy to answer your question. I am very happy to leave the floor to Noémi.
Hello, everybody. Thank you for joining us. So I'm going to to present to you the data from the UK. And we have in our registry 15,000 individuals with sickle cell disease. So France obviously has more people because they have 15,000 children. Here we have 15,000 in total. About 800 with thalassemia and maybe 500 with rare inherited anemias, all different sorts. We haven't got a good number on that just yet. So what we did, very similar to what Mariane has described, is that from the beginning of the pandemic, we had a weekly reporting system where we asked the clinicians from all the different centers to send in some information about any of their patients who got a hemoglobin disorder as well as COVID-19. And here you can see week by week how many people were reported. So it was a steep rise, then a plateau, and then we see the second wave. And what I wanted to also say is that we collected this information without the patient's consent. Why did we do this? Because we thought it was critical that we get this information. It could save lives. If we noticed straight away a pattern, for example, Mariane was mentioning hydroxyurea. If we noticed a pattern with genotype or anything like that, we would want to be able to share this data across the country in case we needed to change what we do to save lives. Because we collected this without consent, we had to collect only the minimal information. So we didn't collect a lot of detail, nothing about people's blood results, nothing about the list of medications they're on, the complications they've had. So this is just the minimum data. And now we're going to get ethics and consent to put all the data together with the extended data and get a better idea. So here is the curve of the different age groups. So you can see the most people were reported were sort of young people, 20 to 29 and 30 to 39, but we did have people who were older as well. And then if we look at the phenotype, so the big blue piece of pie is hemoglobin SS sickle cell disease, which is what Mariane has said as well. But you see the big pink piece is hemoglobin SC disease. And I think it's important. One of the things we thought is important out of this data is to say that even though we often say SC is a milder form of sickle cell, which I don't like to use myself, it's still a risk. And so we have to be careful even with SC to take precautions. And then the next big piece of pie is the pale green, which is the transfusion dependent beta thalassemia. And then you see lots of small pieces for other conditions, but only a very few patients were reported. So the patients received a swab. Some of them were not tested. So if you see on the left side of the pie, we've got the sort of black and white stripe. Those people didn't have a test for whatever reason. The purple ones had a test and were negative, and the dark red had a test and were positive. So in fact, most of the patients had a positive swab test. The next question is how many people needed to come into hospital? And it's about 60%. So for every 10 who were admitted, who had COVID, 6 of them had to come to hospital, meaning still 4 out of 10 people were managed at home. And I think, again, that's really an important message. Obviously, everybody's scared of coronavirus, but the point is that it's not because you have sickle cell disease or any of the other anemias that you will immediately be brought into hospital. No, some people were absolutely fine at home. What about transfusions? Mariane mentioned a third of them received transfusions. So this is exactly the same data we got for the UK. So 2/3 did not receive. So that's our black and white stripes. 2/3 did not receive transfusion. The rest had a transfusion. The dark red had an automated exchange transfusion. The light green had a top-up transfusion, and the blue had a manual exchange. Now, what about transfusions in children? In our children, we had 3/4 did not need a transfusion, a quarter did, and here it was mostly top-up with very few exchanges. And this is for patients with thalassemia and rare anemias. Again, about 71%, so 7 out of 10 didn't need transfusion. And again, this makes sense that they would be top-ups rather than exchanges. So the next thing people wonder about if they have to come into hospital is how severely ill they will be and will they need to go to intensive care. And I've put these pictures here because it's not always easy to know what we mean by all these technical terms, but there's something called non-invasive ventilation. So that's where you get a mask, but it's not just a simple mask. It's a mask that's really tight on your face, and there's pressure to force the air and the oxygen into the lungs. Okay, so this is more serious than if you're on the ward with a normal oxygen mask, but less serious than if you're in intensive care with the tube in the throat. And here you can see actually 90% didn't need this, but 10% of the adults did need this. And then this is the most serious. This is intubation and mechanical ventilation. Here the patient is basically put into a medical coma, so they're not conscious. A tube is inserted in the throat and a machine is doing the breathing. So we found that 6% of the patients required this. And then obviously what happened? Did people go home or did people not go home, or did they get better? So this is the outcomes. So 93% of the patients recovered. We have 3% are still in hospital, and we have 4% of the patients have died. What about children? Well, in fact, we haven't had any children die. We've got 2% still in hospital, and that the vast majority have recovered and gone home. And then this is for the adults. So originally I showed you everything. So inpatient is 3% and the deaths is 5%. So this is another graph that's showing you mortality, which is the main thing people worry about, although obviously not the only thing. And you can see that the greatest mortality was in patients with hemoglobin SS and then hemoglobin SC. But if you remember, we had more patients with hemoglobin SS that had COVID than SC. So that makes sense because it just reflects what we see in the admissions. And then I've got a couple of slides about the second wave. So this is our second wave data, and you can see that when we're looking at the age group, remember the first graph, the age group was 20 to 29 and 30 to 39 was our biggest peak. Here it's younger people. And we're finding this at schools and universities, essentially. What are the outcomes for the second wave? We've got, as you might expect, more of them are still in hospital. And in fact, 10% of them, we don't know the outcome yet because we haven't got the data. So that's why it looks a bit, the recovery is only 83%. And then my final slide is the conclusions. So the risks are real for COVID-19 if you've got sickle cell disease or another inherited anemia, but they're not as high as we might have feared. So when we first saw the COVID infection spreading, we were very worried because we thought our patients are at risk, but actually the risk is not as high as feared. Children are not at increased risk compared to the general population. It's safe for them to return to school. Also, let's remember that the context of the workplace and the social space is now very different from when the pandemic first started. So we can do a lot more of the things that we couldn't do at the beginning of the year. We will be pooling a lot of data. So Mariane presented the data from France, the data from the US. I presented the data from the UK, but there'll be data from Spain, from Italy, from Portugal, from lots of different countries. And now we need to put this data together and get really good statistics and also get ideas about what prevents things getting worse and what makes it more likely for things to get worse. And last but not least, we've got a vaccine coming soon. Right, so that's the end of the slides. Mariane and I are very happy to answer any questions. We wanted to leave a lot of time. We've got half an hour for questions if anybody wants to type them in. Is the vaccine recommended to sickle cell disease patients or not urgently? It's a very good question. And it's a question that probably comes from the worry, which I understand, that actually none of the trials will have been done in people living with sickle cell disease. So what do I think as a clinician? I think I will be absolutely recommending the vaccine. And the reason for that is I already recommend the vaccine for the pneumovax, the vaccine for influenza, and this is just yet another vaccine. There's nothing about this vaccine that makes me think if you have sickle cell disease, you shouldn't take it, okay? On the contrary, in the same reason that I recommend the pneumovax and the influenza vaccine, people with sickle cell disease, when it's offered, I would recommend this. Mariane, do you want to add something about this?
Yes. Yes, I would like to add that we made several trials about vaccination in children with sickle cell disease, and they have always the same answer as the other children. There is no specific toxicity of vaccination in sickle cell disease patients with comparison to non-sickle cell disease patients. They have absolutely the same answers and the same ability to develop antibodies. And it is as effective in sickle cell disease and as safe in sickle cell disease as in other patients.
Okay. Let's see. Sorry, I missed this because I arrived late. Is there any idea of asymptomatic COVID in sickle cell patients? Absolutely. So this is from Katia. We have plenty of patients that we're seeing in clinic and have had a test for a reason or another. Maybe they're traveling, maybe they're having an operation and they're positive and they never had symptoms. So just like in the general population, absolutely, people with sickle cell disease have had asymptomatic COVID.
I had the same remark as you, Noémi. In our clinics, some patients were, for instance, they were undergoing regular transfusion, and they were tested and they were discovered positive, and they had absolutely no symptoms. And they were only tested for another reasons, because they were here for their. So perhaps our percentage of transfusion is a little bit higher, because very often we test the children, not very often, but sometimes we test the children who were undergoing regular transfusion, and they said they had a snore or something very, very benign, and we discovered they were positive.
Yeah. So the next question is, can sickle cell patients travel for work purposes? So at the end of the day, everybody, and it's the same for people with sickle cell disease, has to weigh up for themselves the risks of their behavior. Okay, so can you travel? Of course, we can't stop you from traveling. Is it safe? Well, the safest thing to do is to stay home and not go anywhere. But that's very difficult, and that's not. It has its problems as well. You can't work. You can't go to the shops. It's not good for your mental health. So it's about minimizing risks. So if you're traveling, how are you traveling? Are you taking a train? Are you taking a bus? So you want to make sure that you're in a situation where you reduce your risks. So if you're taking public transport, are you taking it at times that there's not too many people? Are you making sure you're using hand sanitizers? Are you wearing your mask? So it's about those kinds of decisions that you have to make for yourself, because it's no longer possible to stay at home with the doors closed and not do anything. But obviously, there's no way I can tell you, of course you can travel and you'll be safe, because there will always be the risk. Yeah. Given the data and what we now know, this is moving, hang on. Given the data and what we now know, in the UK, will people with sickle cell disease still be classed as clinically extremely vulnerable and still on the shielding list? So deciding that someone's on the shielding list is somewhat of a political decision. So the government had said, and I don't know how it worked in France, Mariane, you can tell us after. The government had said these people are vulnerable, therefore we will make sure that we still provide for them and that they get the food packages and all sorts of things. But for the second wave, that was less strict than the first wave, because we knew that things were safer. And so I think more and more people will be returning to their usual activities, and especially as the vaccine comes along. Mariane, I don't know in France?
No, same answer as you, but the sickle cell disease is in the list of vulnerable people. And I should say that for adults, we saw that they are more vulnerable than the general population, not the children. But for the adults, I think it is a good decision to keep them on the list of vulnerable people.
Then somebody's asking about the difference between the different vaccines available. It's a good question, and a lot of people are asking themselves that. I personally think that we won't have a choice. Again, in the UK, I don't think people will be asked, would you like this vaccine or that vaccine? They work in slightly different ways. The efficacy is slightly different, but I don't think it's going to matter for an individual person. All of the vaccines that will be approved will be good enough. And the big thing is, the more people are vaccinated, the better. Because don't forget that if other people are vaccinated, they then can't pass on to you the infection. Okay, so what we all will try to do is get ourselves vaccinated, but also try and convince other people around to get vaccinated to reduce the transmission of the virus through the population. Mariane, do you have anything to add?
No. I'm looking at the next question, which is difficult because we missed some information. I have an autoimmune disease. They give me an injection. I think that we do not know your case, and it's difficult for Noémi and me to answer you. I think really you have to rely on your doctor, because there are different, in fact, there are different kinds of autoimmune diseases. So I would not like to answer this question, but because it's very, very difficult to answer, not knowing precisely the case. And also, there was any disadvantages or caution for the vaccine in patients with sickle cell disease and disease-specific deficiency? I answer, I do not think that. No, there is no disadvantages or cautions. The answer to vaccination is the same. So no special caution for people with sickle cell disease and disease-specific deficiency.
Mariane, do you want to take the next one about children going to school in the coming weeks? And it's a very topical question about before Christmas.
I think yes, it's for children. Yes, it's getting colder, but I think really we have not changed our mind that school is important for the children' well-being, and whatever the temperature, I would not keep children in quarantine. I think that, and of course, the distance of security cannot be perfectly respected, but really there is a consensus in all countries, in all continents, that children are rarely affected and have milder forms and may suffer from not going to school. So my answer will, with all the pediatricians all over the world, yes, they have to go to school.
So the next question is the same. Other children with other health issues. So a 5-year-old child with splenomegaly and blood transfusion. It's all the same.
Exactly the same, yes, because the more than if the child receives blood transfusion every month, he's protected because he has so much normal blood within his veins that really can go to school.
Yeah. Next question is, what about carriers? No risk for carriers. Okay. There was a lot of, I don't want to say fake news because some of it's not necessarily fake news. At the beginning of the pandemic, my God, everybody was scared. All sorts of things were going around. Nobody knew what was the right information, not the right information. And there were some publications of people saying that sickle cell is a risk for COVID, but no, okay. There is a risk. There's still a risk with ethnicity. So people from Afro-Caribbean backgrounds, the risk is higher than the general population, but we don't know yet if it's due to something genetic or due to the association between where people live, if you live in a bigger family, what kind of work you do. So at the moment, I feel very confident that sickle cell carrier itself is not an increased risk. It seems the data from the US registry is worse than European registries. What do you think about that? We'll see what Mariane thinks as well. But personally, I think it's a very, very different system there. Okay, and the decision making about people being admitted or not admitted would probably be based differently than in Europe. I think there's a lot more similarity between our healthcare system in the UK and all through Europe than there is with the US. Mariane?
No, I agree, because I was very impressed. We have in Great Britain and in France, we have the same results. And clearly there is a European aspect and American one. I agree with you. And perhaps also in the US, they have a bigger register than we have. There are really a lot of cases. It has a statistical impact. I cannot comment anymore.
And I think also what we've seen with the US is they haven't done all the precautions that we've done here, with the masks and people staying home. It's been very different there. So it could be behavioral as well. So I wouldn't, that's what I think.
I agree.
Any other questions, or have we missed any questions? Is there any contraindication?
Any contraindication to take the vaccine if patients are being treated with hydroxyurea? Surely not. No.
I don't know. In France, do you have any information about the vaccine and your patients? How will you'll roll it out to the patients? Because here we don't know yet.
I don't know exactly. We have, I think, the first lots of vaccination will be given to very old people, and then I think sick patients will be in the second distribution. But we have no more. Data about that.
Mm-hmm. Mm-hmm. What about vaccines and children? Somebody's asking.
The same question, I think. Well,
about children,
they are not priorities because they have mild forms, but it depends on the children also. You have severe children with very severe forms and children with not severe forms. I think it will be a case-to-case debate.
Yeah, the ones I'm worried about is a pregnancy. I think the pregnant women we won't know because they won't have been again, included in any of the trials, but we give flu vaccines to pregnant ladies. We really recommend it. So I suspect it would be recommended as well in pregnant ladies.
You must be right. I don't know.
So it sounds like, oh, here we go. What about COVID vaccine and all the other medicines we take? Which combinations are okay and which not? Okay, I was going to say there's very few. I can't think of any medications where it's going to be contraindicated. There won't be an interaction between a vaccine and a medication you're taking. I think you were the one who was asking earlier about autoimmune conditions. So obviously some medicines, and you were talking about injections, will put you at risk of infections generally, but that doesn't mean you shouldn't have the vaccine. Okay. Do you know if the sickle cell patients who died had any other complications and why they did not survive? Afi, it's a very good question. In our cohort, it was similar things to what we see in the general population. So older group, people who had diabetes, high blood pressure. I think probably one thing we didn't measure.
I agree. Obesity, diabetes, and also pre-existing pulmonary disease, which may happen in some adults with sickle cell disease.
Yeah. The other thing that's probably true in the general population, and we don't know in our patient group, is the severity is probably related to how much of the virus you're exposed to. So why so many doctors and nurses have been affected, and why so many died? It's because they're working in an environment that the virus is going in and in with every breath they take. Okay. And so if you're in a job where, I don't know, a taxi driver, where you're mixing with lots of different people, that's probably exposing you to more viruses than somebody who's in a job, behind a screen. Obviously, in a taxi, you could have a screen as well. But I think the dose of the virus you get is probably important as well. So, I just wanted to summarize a little bit that it's very scary for everybody. It's even more scary if you're living with a chronic condition. It's particularly scary when people are telling you all the time that you're vulnerable. The government's telling you, your doctor's telling you. It puts you. It will make you think. I think it will be difficult to go back to normal things, and that's understandable. But I think that with all the precautions that are there, and with the arrival of the vaccine, these things people will be able to go back to their normal lives over the course of the next year. Can you explain the sentence on the slide? Previous acute care for pain is associated with more severe course.
In my slides, I wrote the conclusion of the presentation was made by the US. When I think it is very logical. We know in children, in pediatric, that some children are painful and some children are never painful. We know that some children have recurrent painful crises and some children have never pain. And it seems logical that children who have recurrent painful crises, when they are infected by COVID, may have a painful crisis. And that children who are never painful are not painful when they have a COVID-19 infection. So it is not surprising at all. When you have repeated crises, all of you know that you may have a new crisis. And when you have never pain, it's more rare to have pain. So it's not surprising at all.
Laura Ruth is asking, would you advise sickle cell patients in such jobs to isolate or consider other options? So sometimes it's not possible to consider other options, right? So I guess the question is, let's say you're a taxi driver, what do you do? So if you're a taxi driver and you don't have the opportunity to go and do something else, do a job that you can do from home, and your employer obviously doesn't, says, if you don't come to work, I'm not going to pay you. You have to sort of think, what can I do to make sure that I reduce those risks? So it's about risk reduction. It's about, well, okay, does my taxi have, I'm just using this as an example, the taxi driver, but does my taxi have a per perspex screen between the customers and me. Can I drive with the window open? I might get cold. Maybe I'll need a blanket. Can I make sure that actually after I take a customer and I drop them off, I open the doors to let the air through? So it's about thinking through everything you're doing to reduce the risk. And I heard somebody describe it like we have a budget of contacts or something like that. So let's say in your job, you don't have an option and you have to come across other people in contact. Well, maybe what that means is in your personal life, you then reduce who you see. Or maybe you're not the one who goes to the shop to do the shopping and somebody else does the shopping for you. So that you sort of, because you have to have more contacts with your work, can you reduce your risk by reducing the contacts in the rest of your life, if that makes sense? If you have children going to school every day, it increases the exposure.
I will answer this one, Noémi.
Yeah.
What we have done in Paris, in Parisian area, and also in France, we have tested children, and we have seen that children were not infected at school. They were infected by their parents when they were living at home because the parents were contagious and not the children. So this is my answer. You may get infected everywhere, but you may be infected by your father and your mother. And therefore, I would answer that the message is to go to school as much as you can. Any question, Mariangela? Maybe we don't follow the sickle cell disease just because they're very careful. If they didn't fear, maybe the results were worse. I would say, but as an adult doctor, Noémi will also, yes, we don't know. Maybe there are people who think that sickle cell disease patients have a sort of protection because of specificity in their blood groups. There are publications on that. I don't know. Really, the answer is I don't know. If the patients with the children, I know that the children have less severe COVID infection because they are children, and in the adult, I can't answer.
Antonia, I think you are completely right to raise this, and having spoken to so many people with sickle cell disease over the last year, really, I now do all my consultations by video, and it's been really interesting that people, to me, seem to fall into one of two camps. Either they have the lockdown and all of this has been wonderful for their health because they've not had to commute. They've been able to stay warm and not be rushing out in the cold. There was less stress to manage around the workplace. They managed to do more of what they like, more hobbies, etc. And some people say their health has never been better. Or people fall in the other camp that says it's been absolutely dreadful. The stress of the lockdown, being stuck in a room by yourself, not seeing the people you love, all of those things. And yes, so what I'm trying to say is, yes, you're right that maybe people have been okay because they've been stuck at home. But being stuck at home has also had its very negative consequences. And I think Mariane also said that about the children being admitted with sort of psychological consequences. And therefore, I think they would cancel themselves out. So maybe you're right that if people had been more out and about, we would have seen more severe COVID infections, but then we wouldn't have seen so many of the people who really struggled with the lockdown. And I don't think we know the answer.
And if I may add something, during the period of quarantine, where consultations were made by video, it was a disaster for me because I think that I could miss some splenic problem. For instance, some children, they may have a spleen who is increasing and it may have an impact on the health of the child, and I could not know. And also, some screening could not be made, such as a transcranial Doppler, and it was taking risk for the children.
Okay, so I guess if that's all the questions, then thank you very much all for coming.